Senator Collins.
Thank you very much, Mr. Chairman. And I want to thank all of our witnesses today for your dedication and hard work. It's really been important. The chairman raised a very important question about who pays for the testing when a person has no symptoms and no known exposure to the virus. And I would add another key question, and that is, how are such tests even accessed? These are critical questions for the reopening of schools and for the thousands of jobs in the tourism industry upon which Maine's economy depends. In Maine, for a tourist to come and visit, that out-of-state visitor, one option is to show a recent negative COVID test. The problem is that when hotel owners in Maine surveyed testing sites in 10 states, they found that 90% of requests for a test for travel purposes were denied. Now, this lack of access to tests is devastating for reopening Maine's tourism businesses. One innkeeper told me that last year in the month of June, she had an occupancy rate of 94%. This year, it was 6%. So you can imagine the impact on employment at that inn. Given the impact on reopening schools and on jobs in the tourism and other industries, how is the federal government working with states to better match demand for testing with supply and to overcome these geographic variations? Admiral, I would direct that question to you.
So thank you, ma'am. I will try to be brief and not to take much of your time, but we were very careful in our prioritization that we do prioritize persons without symptoms who are prioritized by health departments or clinicians for any reason, including public health monitoring, surveillance, or screening of other asymptomatic individuals according to state and local plans. So that is a priority, that if it is important for the state, those asymptomatic individuals can be screened. The second issue, just again to be brief, is we have worked individually with every single state to determine what their state testing needs are, how are they organizing in the context of the CDC, and we are supplying them with the supplies they need to meet that. So every week, shipments of the basic supplies go to every single state according to their state testing plans. And we keep a little bit in reserve, right? Because when there's an outbreak somewhere that we need to surge, we do have that. So for example, the state testing goals for July are somewhere across the country, about 13.9 million tests is their first line goals, and we will match those state by state.
I hope that you will help us get that word out to testing sites in states from which a lot of tourists usually come to Maine. That would be very helpful to us. Dr. Fauci, let me turn to you. Earlier this month, higher education leaders in Maine issued a framework for safely returning to campuses this fall that recognizes the importance of testing and the need to include financially struggling institutions in partnerships in order to make sufficient testing protocols possible. You last week spoke about the possibility of the development of pool testing strategies. And as I understand this would allow more people to be tested using fewer resources. And the medical director of Stanford's clinical virology lab suggests that this makes particular sense in areas with low rates of COVID-19, where you would expect the large majority of tests to be negative. Could you expand on the possibility of expanding pool testing and tell us more about that?
Yes, thank you for the question, Senator. What that really is, if you want to get a feel for the penetrance of infection in a community, rather than testing each individual person, which takes resources and time, what you do, and you can do a statistical analysis of not losing sensitivity by pooling, let's say, 10 or 15 or 5 together. So you put all the tests together and you do one test. If that test is negative, then you know those 10 people are all negative. So instead of utilizing 10 tests, you've utilized one test. Then you get another batch of, we'll say, 10 or so. And if you then find one is positive, then you go backtrack and figure out who that person is. And if you do the mathematical calculation, you can save a lot of time, a lot of resources, and use the testing for a variety of other things that you would need. So it's a really good tool. It can be used in any of a number of circumstances, at the community level or even in school if you wanted to do that. So apropos of what you started your comment off with, it clearly can be extrapolated to that.
Thank you so much. That sounds like an excellent technique for our schools to use.
Thank you, Senator Collins.